As the healthcare authorities prepare for an impending third wave of Covid-19, Chief Scientist of the World Health Organization Dr. Soumya Swaminathan gave some ray of hope and said that India might be entering some kind of stage of endemicity. The level of transmission, she said, will be normal to moderate, and exponential growth and peaks that the country witnessed a few months ago are unlikely. We explain what is an endemic and how it affects us. An endemic is a disease that is consistently present but limited to a particular area. According to the Columbia University's Mailman School of Public Health, unlike an epidemic, an endemic does not overwhelm a population. According to Dr. Soumya Swaminathan, the endemic stage is when a population learns to live with a virus. It means its spread is limited to a particular area and its rate of spread is predictable. For example, an endemic virus in the US that remains in the population at a low frequency is the seasonal flu. In March 2020, the World Health Organization declared the novel coronavirus as a global pandemic. A pandemic is prevalent over a whole country or the world. The endemic diseases, however, like chickenpox or malaria, are not novel or unfamiliar, and the rates of infection within a given population are fairly predictable. Experts say that becoming an endemic is the natural progression of many infections we have as humans, whether it is TB or HIV. Medical experts are now saying that the Covid-19 pandemic could become the next endemic. According to immunologist Jonathan Grad, the optimistic view is enough people will gain immunity through vaccination or from natural infections and the pace of transmission will fall considerably. While Swaminathan in her latest interaction has signalled at India entering some kind of a stage of endemicity, she also said that the situation in India will continue with ups and downs considering the size and heterogeneity of the population. But because of the emergence of new variants, especially the Delta variant that spreads so quickly, most experts think herd immunity is no longer realistic, even if vaccination rates rose to the levels previously thought necessary. Not all countries have given up on the hope of a zero-COVID world. China, for example, is pursuing a zero-tolerance approach to the virus, with strict lockdowns, contact tracing, testings, and quarantines. Australia too has sought to shut out the virus with closed borders, lockdowns, and widespread testing. The highly contagious Delta variant, however, is still managing to penetrate both countries, calling the long-term viability of a zero-COVID strategy into question. Every disease pathogen that has affected people over the last several decades stayed in some form or the other, as it is impossible to fully eradicate them. Pathogens like malaria that are very old still put a heavy disease burden in some parts of the world. So do other epidemics like TB, measles, and leprosy. Even plagues returned every decade. The only disease that has been eradicated through relentless mass vaccination campaigns is smallpox. Higher vaccination rates may in some areas eventually stop Covid-19, but that depends on how many people get the vaccines, how long they last, and how effective they are at reducing transmission over time.